The sacroiliac joint plays a crucial role in the biomechanics of the pelvis, acting as a key structure for weight transmission between the upper body and lower limbs. This synovial joint exhibits a limited range of motion while providing significant stability and support for various activities, such as standing and walking. The sacroiliac joint stability is largely due to its unique anatomical features and the presence of robust ligaments. The articular surfaces of the sacroiliac joint are irregularly shaped, interlocking to create a stable connection that is further reinforced by the interosseous sacroiliac ligament, posterior sacroiliac ligament, and anterior sacroiliac ligament. These ligaments serve to maintain joint congruence and support the weight transfer from the spine to the legs. The joint is encased in a fibrous capsule lined with synovial membrane, allowing for minimal movement while providing lubrication and nourishment to the joint surfaces. In terms of functional biomechanics, the sacroiliac joint facilitates a small degree of gliding and rotational movement. Primary movements include anterior and posterior innominate inclinations, which occur as the hip bones tilt forward or backward while the sacrum remains fixed. Additionally, the sacroiliac joint allows for antagonistic inclinations during activities such as walking, where one hip bone moves forward while the opposite hip bone moves backward. During upright activities, the sacroiliac joint's biomechanics are essential for maintaining stability and balance, effectively distributing forces throughout the pelvic girdle. The joint also engages in movements known as nutation and counternutation. Nutation refers to the forward tilting of the superior sacrum, while counternutation is the backward tilting of the superior sacrum. These movements are crucial for optimizing the transfer of rotational forces from the lower limbs to the spine, enhancing functional performance during various activities. The pathobiomechanics of the sacroiliac joint involves understanding the functional disruptions and injuries that can occur within this joint, which is crucial for transferring loads between the lower limbs and the vertebral column. Various conditions can affect the integrity and performance of the sacroiliac joint, leading to pain and dysfunction. Intricate design and the support from ligaments and muscles provides the joint stability. However, when there is an imbalance or disruption in these stabilizing mechanisms, it can result in sacroiliac joint dysfunction. Such dysfunction may manifest as either hypomobility, where the joint becomes excessively stiff, or hypermobility, leading to excessive movement that can cause pain and instability. The ligaments surrounding the sacroiliac joint play a significant role in maintaining stability. In women, the ligaments exhibit a degree of laxity to allow for necessary mobility during childbirth. This anatomical variation can contribute to differing pathologies in men and women, with women being more susceptible to sacroiliac joint pain associated with pregnancy and hormonal changes. Additionally, conditions such as sacroiliitis, which involve inflammation of the joint, can lead to severe pain and altered biomechanics due to swelling and restricted movement. On the other hand, muscle imbalances, particularly those involving the gluteus maximus and piriformis muscles, can also affect sacroiliac joint stability and function. When these muscles are either overly tight or weak, they can exert abnormal forces on the sacroiliac joint, potentially leading to abnormal motion patterns or compensatory mechanisms in adjacent joints such as the lumbar spine and hips. Such compensatory movements can contribute to a vicious cycle of pain and dysfunction in the lower back and pelvis. Arthritis, trauma, and degenerative diseases, osteitis pubis, and related inflammatory conditions can alter the normal biomechanics of the pelvis. In a sacral torsion, the normal nutation and counternutation movements of the sacrum are disrupted. This can lead to abnormal stress on the sacroiliac joint and surrounding structures, resulting in pain and dysfunction. A sacral torsion often results in pelvic asymmetry, where one side of the pelvis appears higher or more rotated than the other. This can affect gait mechanics and lead to secondary issues in the lumbar spine, hips, or knees. Physical examinations are essential for evaluating sacroiliac joint dysfunction and typically involve a range of clinical tests aimed at assessing the range of motion, muscle strength, and reflexes in the lower back and legs. It is necessary to analyze the patient's gait pattern and any differences in leg length, as these factors can be indicative of dysfunction in the sacroiliac joint. For more details regarding the provocative tests, please watch the practical tutorial videos. The treatment of sacral torsion syndrome focuses on restoring normal joint mechanics, reducing pain, and improving function. Physiotherapy interventions are tailored to address the underlying biomechanical dysfunction and any contributing factors. Joint mobilization includes gentle mobilization techniques can be used to restore normal joint mechanics and reduce the torsion. Techniques include anterior-posterior glides on the sacrum to address hypomobility and iliac crest mobilizations to correct pelvic asymmetry. In some cases, high-velocity, low-amplitude manipulation may be used to correct a sacral torsion, though this should be performed cautiously and only by trained professionals. Soft tissue release, myofascial release, and trigger point therapy can be applied to tight muscles around the sacroiliac joint, such as the piriformis, gluteus maximus, and iliopsoas. Exercise therapy includes core stability exercises, pelvic tilts, dead bug exercise, gluteal strengthening, stretching of tight muscles, piriformis stretch, postural correction, and ergonomics education. Electrotherapy modalities include heat-ice therapy, electrical stimulation, ultrasound therapy, diathermy, laser beams. Sacral torsion syndrome is a specific form of sacroiliac joint dysfunction characterized by abnormal rotational movement of the sacrum relative to the ilium. Physiotherapy plays a vital role in addressing both the symptoms and underlying causes of sacral torsion syndrome. By combining manual therapy, exercise, education, and modalities, physiotherapists can help patients achieve pain relief, restore normal joint mechanics, and prevent recurrence.